Hello. So I thought I'd give you some really good tidbits after all that we've discussed. And as you can see, with all the tools that we still have available, all right, you're wondering, well, how often do I have to floss? How often do I have to brush? We said IFBI after each meal. That's your basic rule. That's at home. But now, how often do I need to see the dentist? So the rule of thumb is that you will be told, depending on the type of gingival levels that are damaged or bone loss, periodontal disease or not, gingivitis or periodontitis, your doctor will determine how often you need to come back. That's why we use our little ruler that I mentioned earlier on, where we go around each tooth and we measure to see where the gums reattach to the bone. We're actually going to determine, that is going to determine how often we recommend you come back. Not necessarily, oh, you need to come back every 3 months, 4 months, 6 months. No, it's how well you IFBI at home that's going to determine how often you need to come back. Right? The ball's in your court. One thing I do want to tell you, and this is very important, you know the little tools that you find at the flea market, that are dental tools that you find at the flea market, that people say, oh, I use those dental tools at the flea market. Do you know why they're at the flea market? Because they're not good, because we got rid of them, because they're not good anymore. So please don't buy the dental tools and the picks that you find at the flea market to clean your own teeth. One, they're not sterile. God knows where they've been. 2, they're not good. 3, they're not sharp. And 4, they're going to hurt you in any single which way imaginable and possible. All right? We have special tools that are specifically made for you, specifically made for certain areas. As I mentioned earlier on in the scaling and root planing, they're angled in a certain way to cause the least amount of discomfort and or pain and or trauma to the tissues. And also they'll have a much more beneficial effect. And also they're sterile. They're sterilized every single time we use them. They're clean, scrub, sterile, and they're safe. So with that in mind, your doctor's office, your dentist's office, your visit to the dentist should be a clean, sterile, pleasant one for you that you should look forward to. And remember, IFBI. Talk soon. Bye-bye.